welcome to this special interview on robotic surgery by Dr. Vardhan Bhobe in association with Prudent Media and RG Hospital, Goa. Dr. Vardhan Bhobe is the Medical Superintendent and Chief Laparoscopic Surgeon at RG Hospital, Goa. He has performed over 7,000 laparoscopic surgeries and nearly over 10,000 open surgeries. And I have had the opportunity to intern under him in those days, 10 years back, when Sir was working at Asilo Hospital, Goa. Dr. Vardhan Bhobe, welcome to the show. So, Doctor, to start off, what is robotic surgery and how did this all start? How did robots take over, surgery?
So basically, robotic surgery is an extension of laparoscopic surgery. It's a much more refined and a specialized field, whereby there are special robotic arms with which moves 360 degrees, and it can reach a lot of depth, which is not possible to reach in laparoscopic surgery.
Okay.
And with the help of these arms of robotic surgery, the patient is operated upon. Many years back, you see, about maybe a century back, that's when surgeries were in initial stages, and patients used to be ripped apart with open surgery scars with more than 10 centimeter, 20 centimeter sometimes, the whole of the abdomen. Then there was slight refinement, and the scars became slightly less, and patients started being operated with lesser incisions. Then came the era of laparoscopic surgery, whereby the big incisions were small, were converted into small holes, and through those holes there was a telescope, and then the working hands. So from surgery, open surgery, it came to minimal invasive surgery. But then we realized that there is some limitations where laparoscopic surgery becomes a little more difficult to perform, and during those difficult times, if there's any injury or some bleeding or some complications, then there could be chance of opening the patient and all that. So then the robots were introduced into this, whereby the depth of the abdomen can be reached in a very good manner. The vision is 3D vision, so you can see the whole of the situation in a proper sphere and see the structures adjacent to each other, and do the surgery in a far more refined manner. So that's why the robotic surgery got introduced and has taken it in a big way.
Right. So, Doctor, what are the benefits of robotic surgery?
Robotic surgery basically is far more advantageous as compared to most of the other types of surgeries, in the sense that it gives very less pain to the patient. It has minimal scars, very cosmetic ones, so patient does not realize also that there are scars on the abdomen. Then the time taken for surgery is shortened. The chance of bleeding, because you can see the structure in relation to each other. So your dissection skills and all become extremely good. And because the movement of the arms of the robot is almost 360 degrees. If you see, the wrist moves at a particular angle, but in the robotic surgery, the wrist moves all over. So that's why you can perform the surgeries with absolute precision. And that's the advantage of robotic surgery over any other surgery. And the lesser the number of complications, lesser the chance of infection, lesser the chance of infection, lesser the stay of the patient in the hospital, and patient returns to work like in 3-4 days time after any major surgery as well.
Right. So which surgeries are covered under robotic surgeries? Any surgeries can be performed, or there's a specific types?
I would say the most important usage of robotic surgery are in abdominal surgeries, whereby the abdomen is huge in very big dimensions, transversely as well as vertically. So the surgeries like hernia surgeries or fundoplications, where there is a loose valve between the food pipe and the stomach. Okay, this can be performed with very nice vision and extremely precise steps, and that's where the benefits of this surgery comes. So anything in the abdomen, cancer surgeries, rectum surgeries, then even prosthetic surgeries, where the open or laparoscopic repairs don't give that much desired effect, that there the robotic surgery is extremely important. Let us even take an example of an appendix surgery. To everybody, the appendix is just an appendix, but sometimes the appendix can be placed in such an odd manner whereby you can't see where the appendix is.
Right.
So here, by using this facility of robotic surgery, we can see all over and in a very precise manner where the large intestine is in relation to the appendix and do the surgery as well. So I would say any abdominal surgeries can be accessed very well by robotic surgery. And the surgery can also be extended to thyroid surgeries as well, whereby the robotic arms can be placed below the armpits to go to the neck and operate there as well. So, surgery, it goes stepwise. Initially, you start a particular surgery, then you go to little advanced and difficult surgery, and then sky is the limit for any type of surgery performed. And precision and accuracy, these are the two key words in robotic surgery. So less incisions, less chance of bleeding, less chance of infection, very early discharge for the patient of robotic surgery, and early return to work. So these are, from the patient's point of view, extremely very good. And from the surgeon or the hospital point of view, I would say the surgeon's point of view, the surgeon, like, these major surgeries sometimes takes around 6 hours when we are doing a robotic or a laparoscopic surgery. So no, I would say the time may be same or slightly less. But here, if the surgeon is operating 6 hours in a standing position, with his shoulders always inside, he is very strenuous, when you try to operate. Here, because of the robotic surgery where the surgeon sits on the console, he's more comfortable. He can move his arms well. You can use the arms. You can sometimes relax the hands. So. At that, those are the very big benefits from surgeon's point of view. And if the surgeon is very relaxed at the time of surgery and can relax at the time of surgery as well, is obviously beneficial for the patient as well. Because surgeon is more relaxed even during the end of the surgery and can perform very well. So that is the advantage from the surgeon's point of view. And from the hospital point of view, I would say, since initially for any type of surgery, you also seen that so many assistants and all are required. A surgeon is not the only person there. There are assistant surgeons, there are assistant nurses, there are so many other nurses, circulating staff and all. Here you have the surgeon on the console managing the show, and you have the assistant managing the show from the patient side. So you just two people who are managing it, in addition to the anesthetist and their team. So the staff required also becomes much less.
Much less. Right. Manpower dependency is less.
Yes.
So, sir, just thinking about the patient's thought process, like as a patient always chooses the best doctor to go to get treated with. So, at the back of the patient's mind, it will always be there, that it is the robot who's operating me, it's not the doctor who's operating me. So, what is your thoughts on this?
Yeah, so robots are basically means we are inspired by Rajnikant movie, the robot where Chitti robot was there, where he does everything.
Yes.
But here it's not like that at all. This is a surgical field where the robots are specialized to be under the control of the surgeon.
Right.
So basically, we have got a surgeon's console, and the surgeon uses his hands to for the movements inside the abdomen of the patient. So the surgeon controls everything.
Like it's not.
It's not that you say, okay, remove gallbladder, and this robot is going to, then it's going to be the rogue robot and maybe remove some other organ and cause more damage.
I asked you the question.
So it is absolutely on the surgeon's hand. It's just that the facility is there where all the things can be done, but the ultimate control is with the surgeon.
Yes. That's what I wanted to know. So, on those same lines, like you said earlier, that there is a lot of decrease in manpower dependency. So, ultimately, what does your team in robotic surgery consist of? What is it made of?
Yes. So, it's a very good question. It's basically the surgeon, And if you require, you can have a surgeon assistant, or you can require, or you use the OT assistant.
Right.
So, now the all hospitals in the OTs, there is a OT assistant already, right? So initially, for the first few cases, it would be best to have a surgeon assistant, and then reduce the dependency on the surgeon assistant and then just concentrate on the OT assistant. But you require only one person in addition to the surgeon to do the surgery confidently.
So in RG Hospital, is it the first hospital that has started robotic surgery? And what are the facilities that you all provide at RG Hospital?
Yeah, RG Hospital has definitely bought a robot in the recent times in the last 6 months, but other hospitals in all over India also have got. There was a separate robotic system called as Da Vinci system, but that was a fixed system where the whole OT, there is a fixed system and you cannot move it. But the advantage of this system that RG has bought is called as CMR, Cambridge Medical Robotics Center. So Here, this is a portable robot. I mean, this was never thought that this could also be used. So, there,
like you have a portable X-ray machine,
absolutely,
something like that.
It's exactly like that. In fact, it's so handy that it can be shifted from one hospital to other as well.
Oh,
So
okay.
yeah, the arms, each arm is separate, and each arm can be moved. The surgeon console is with wheels, so that also can be moved. So this is an excellent product that the CMR surgicals have come with, you know.
Right.
So this is yeah, and RG Hospital basically always innovates and brings the best of the technology and most of the recent technologies for use in the patient, because here we don't like to compromise with the health of the patient at all. So we have got, in addition to the laparoscopic surgery, the new robotic system, which has just come in the last 6 months in RG Hospital, and we are doing quite volumes of work even in Delhi, where you know very complicated and advanced cases are being done in the RG Hospital.
Right.
And primarily the RG Hospital it was a urology center where you know all the best of the gadgets of urology are used.
And now it has evolved into multi-speciality.
So, yeah, now it is a multi-speciality hospital where all the things are available, including the intensive care unit. Then there is a nephrology unit where there is a full dialysis center. In fact, RG Hospital in Goa has got one of the highest dialysis beds as well as number of patients here in the hospital. And all the things are advanced and the best of the lot available in India here.
So, doctor, in robotic surgery, what is the size of incision, and is the blood loss as open surgery, or is it much less?
Oh, definitely the blood loss would be minimal to hardly minimal. There won't be any blood loss, because here you are seeing each and every structure in the right perspective.
Right.
So you're definitely not going to go into the blood vessels and you know and try to rupture them and cause bleeding or anything like that. So definitely the blood loss is less, and that's the essence of a laparoscopic or a robotic surgery. I mean, this has to be much less. In fact, if you just think about it, an incision which is around 10 centimeter, and here whatever robotic incisions that we give are just 1 centimeter or even less than that, 5 millimeter, sometimes as small as 5 millimeter or 3 millimeter. So these incisions are definitely not going to bleed at all. Whereas an incision which is 10 centimeter, sometimes 25 centimeter, imagine the blood loss that will be there. And it's not just the incision blood loss. You know, all the incisions have got blood supply, have got nerve supply as well. So this causes pain in the very immediate post-operative period, and much later also, because you know then there is a lot of numbness around the area because the nerves are cut. It takes time for the nerves to regenerate. So these are all, you know, the benefits which you get in minimal invasive surgery of robotic surgery. And inside the abdomen, when you're doing an open surgery, so many hands are used, so many instruments go during performance of the surgery, and however much you try, you know, the blood loss will definitely be much more than what you would achieve by this type of robotic surgery. Definitely.
So I think chances of infection also are much less.
Yeah,
as
infection.
compared to laparoscopic or open.
Yeah, infection is basically directly proportional to the amount of blood loss. More the amount of blood loss, more the organisms are going to be harboring the abdomen. So you know, less the bleeding, less the chance of infection. Then in patients who are obese, you know, patients have got a lot of fat on the abdominal wall. You know, Indian population is actually, if you see, quite a lot of it has got less people are going into exercises and all that. So their abdominal fat is very low as compared to rest of the body fat. That's called as central obesity. So when you operate on such patient with central obesity, there is so much of fat there that this causes fat necrosis in the post-operative period. The fat necrosis by itself because of the blood supply being cut off. So when this necrosis happens, there is all watery fluid which comes out, and that is the highest source of infection which happens in the immediate post-operative period. So when you do robotic surgery, these incisions are just 5 millimeter or 1 centimeter at the most, where there will be chance of fat necrosis, hardly ever. So you know the chance of infection is not there, hardly.
So doctor, talking about obesity, what is the scope of robotics in bariatric surgery? Is there a scope for it?
Definitely huge scope in bariatric surgery as well. Here, why it is so advantageous doing a robotic surgery is that when you do a bariatric surgery, here there are so many steps where there is chance of blood loss.
Blood loss.
When there is bariatric surgery being done, the incisions and the instruments required are extremely huge, because these patients come with a huge body mass index, and the abdominal wall and the abdominal cavity are huge. So the instruments are specialized and they require long instrument. Robotic surgery can achieve this by minimizing the use of all this, and they have got specialized instruments to do that. So definitely it's doable and much better in bariatric surgery as compared to laparoscopic surgery. And again, as I told you, the vision and the extent where the camera and the instruments can
Is
go,
much more than
and
the
how
human
the instrument maneuver, like the degrees, 360 degrees, is you can suture.
Yes.
For me, while doing laparoscopic surgery, you have to suture like this. When I'm doing a robotic surgery, it can be done in every angle.
Every angle.
So,
Doctor, can this robot be installed in any hospital setup, or is there a certain criteria for robotic surgeries?
Yeah, so robotic surgery can be done in any setups, but the setup should be well equipped, and the setup should have a space. So it's not that the robot or the surgical console where the surgeon is operating from is kept somewhere outside the OT. The surgeon console has to be inside the OT, next to the patient. So the OT should have that much space for the surgeon console and their arms to be placed there.
Right.
It's not only that. Once they are placed, there should be movement. That should be place for the movement of people, right? Staff of to move here and there. So that place has to be really large to accommodate all these things.
Right.
Then it should have a proper Wi-Fi and all attached to the
and I
OT
think
and
also
all.
the electricity and generator backup.
Absolutely,
and all of that.
UPS is a must for all this. So if that is available in any hospital, then definitely why not? I mean, the robotic surgery should be done at most of the places.
So, doctor, do you think that this is going to be the last frontier in medical surgery, or do you think there will be more innovations besides robots trying to do surgery?
See, I'll put it this way, if let us say I was born maybe 100 years back, I would have thought, okay, good, I have operated this patient and I can remove the gallbladder or appendix or hernia, and patient goes home very well.
Yeah.
I would have thought that, okay, I mean, this would
We
be
have
the
achieved
end, there would have been nothing else to it.
Yeah.
But then slowly, the things progressed, and then came the laparoscopic surgery,
From
where
general anesthesia, we've moved to blocks and spinals.
Exactly. And then, but
from no anesthesia, in fact, from no anesthesia in the beginning.
No anesthesia in the beginning.
Yeah.
You just hit the patient on the head, and there are cases discussed like that.
Yeah.
Mind you, in laparoscopic surgery as well, initial days of laparoscopic surgery, the surgeon was ridiculed. Okay, what surgery you are performing? This is the way to do. But then once it caught up, then it caught up in a real big way.
And there was a reluctance in patients also. They wanted open surgery over laparoscopic surgery.
Definitely. Even now, sometimes my patients say, no, open surgery. They think that, laparoscopic surgery is
something might be left
like
behind, something might not be seen.
So that way, I would say that laparoscopic surgery evolved, and now, it would be criminal not to do a laparoscopic surgery rather than open surgery. Other than if patient has got some contraindication where strictly you cannot do a laparoscopic surgery, then it's a different story.
Yeah.
But otherwise, laparoscopic surgery was very good.
The ultimate.
But then again, the surgeon had some problems in doing some surgeries where the vision was not the greatest. You could not reach to those depths of the abdomen and all that. So that's why the robot, which was initially more of non-medical robot, right? Then the surgeon thought, okay, why not use the robot and see, and then definitely you see the desired result where the surgery has become so easy. So now we are thinking that, okay, the robotic surgery is the final frontier. But God knows, maybe Dr. Stacey, in 10 years' time, we would be sitting here again and talking about some new surgery.
Yeah.
So,
right. So, doctor, we have heard about telerobotics in other fields.
Yes.
What is the role in medicine and surgery?
Telerobotic is now picking up in a big way, because in other fields it is slightly different, where it's not they are not dealing with the life of the patient, because here the patient is on OT table, and then the surgeon has to be performing from there. So that is not yet started, okay, at least in India. But maybe a time will come that's why I said final frontier is this. We don't know. So a time may come, if the medical ethics and these regulations are to be followed, where a surgeon is stationed at a different place altogether, and the robot is working for him under his instructions at a different place. But right now, it is limited to the surgeon sitting in the console, in the OT room next to the patient. Okay, and that surgery can be televised live to the rest of the world. So in that form, yes, it can be televised live to the audience all over the world. But surgeon operating from distant has not yet become a reality. But once the rules are in proper place, and the robot also is that friendly where these things can be done, maybe it would be, yeah, we have to see, we have to wait and watch for that.
Right. Doctor, I'm very curious to know, how do you choose your patients for robotic surgery? Does every patient who comes to you can be a candidate for robotic surgery, or is there a certain criteria for it?
Here, I would like to say that there are certain contraindications in robotic surgery or laparoscopic surgery as well, where you decide, okay, I think this patient is not fit for any kind of keyhole surgery. Like a patient who has been operated multiple times. When the patient is operated multiple times in the abdomen, there are a lot of adhesions inside, and just inserting some instrument inside or the laparoscope inside is going to cause trauma. So here you have to be very gentle and proper when you're giving the incision, and dissect all the adhesions aside, all the bowels and all that. Yeah. Sometimes patient can have bleeding disorders where you cannot just operate the patients and cause a lot of bleeding. So leaving these contraindications aside, any possible person who comes with a probable complaint and a reason to be operated is a potential candidate for a laparoscopic or a robotic surgery. Yeah.
As we know, in laparoscopic surgery, the stay in hospital is much less compared to an open surgery.
Yes.
How would you compare that to a robotic surgery? What is the length of stay in a robotic surgery?
I would say almost similar, if not less than that. You see,
similar to a laparoscopic surgery.
Yeah, similar to a laparoscopic surgery in terms of recovery and going back at work. Slightly more better because the chance of bleeding, risk of infection is much less. Otherwise, the incision pain is much less, and the disadvantages are extremely beneficial in robotic surgery. And once this is all done, like I operate a patient, let us say, of an incisional hernia or gallbladder surgery, patient goes home within 24 to 48 hours, and 3-4 days sometimes they go back home. Within a week they travel abroad. Some of them, some foreigners who come from outside to have the surgery done, they do the surgery and they travel back at their work.
So, doctor, is there any other departments in medicine that can be covered by robotic surgery, or is it only abdominal surgery?
Yeah, I would say it is also very beneficial to urologists to do a radical prostatectomy. This is a very extensive surgery, and the results of robotic surgery for this are extremely phenomenal when doing a radical prostatectomy for CA prostate, cancers of the prostate or something like that.
Right.
For gynec, doing a hysterectomy or doing fibroids and all that, where these are refined surgeries, and there is a huge chance of bleeding, and if not controlled well or seen well or done well, can sometimes be disastrous. So we have to be very particular and very specific at this time. The world also is going towards that, where nobody wants any complication to happen, and the doctors themselves will not like to be in any litigation for anything, and that's why I think this surgery has got a role for them as well. ENT surgeons doing thyroid surgeries. So the role of robotic surgery is far and wide. It's not restricted only to a surgeon, but it can be performed by various departments as well.
Right. So, doctor, how did you train into robotic surgery, and what would be your advice to aspiring surgeons who want to pursue this path?
Yeah, so first of all, they have to be surgeons. That's most important.
Aspiring surgeons.
Yes. So the surgeon should be very well trained in laparoscopic surgery. First thing, they cannot be a very good robotic surgeon unless and until they first be a surgeon, because if suppose robotic surgery or laparoscopic surgery fails for certain reasons, you have to be an extremely good open surgeon to be doing all this and handling the problems or complications. So first of all, you have to be a very good surgeon, as we said.
So like they should follow you and do 7,000 laparoscopic and 10,000
I wouldn't say that. I never said that. You can start doing a laparoscopic surgery first and then take a robotic surgery. That would be the appropriate thing. So first I would say that they have to train themselves to be a surgeon, very good surgeon handling everything. Then the next step would be doing a laparoscopic surgery, and that requires a good 6 months to 1 year training. and get precision in by
Good skills.
doing those surgeries and performing those surgeries, and then venture into robotic surgery. Because you cannot have a reverse way where you do robotic,
Right.
then try to convert
Then
to
try to-
laparoscopic, and then try to
Absolutely.
convert into open.
It's-
So you
it's
have
a
to be.
super specialty.
It's a super specialty. When you are an extremely good laparoscopic surgeon, there's a 3-day training for robotic surgery, and that's enough.
That's
When
enough.
you're an expert laparoscopic surgeon,
You don't
just
need to be
require
taught the basics.
Not you don't require
Yeah.
the basics are already taught
Already
to you.
taught to you, yeah.
You know, so that apart, the robotic training just take 3 days or so for getting trained, and then you can start doing a robotic surgery initially on simple surgeries, and then start doing complicated and involved surgeries. So
Right.
that's how is the
growth.
Yeah, growth, I would say.
So, what inspired you to come into robotic surgery? What was your journey into
Yeah,
robotics?
I said Rajnikant, the
Rajnikant.
Chitti. So
Okay.
robotic surgery is supposed to be, you know, it's fascinating world where first of all going into the abdomen and seeing on a screen, and this is 3-dimensional. So you know it is amazing.
Right.
Just like some people, scientists, they are so much engrossed in the galaxy and so
Yeah.
many other things, you know, exploring things. That way a surgeon likes to explore the farthest thing in the abdomen as well. Like,
Yes.
what's there? What's
the abdomen
there?
is your galaxy.
Abdomen is our galaxy,
Right.
exactly. So you know, I always would like to myself to be updated on the latest scientific knowledge and you know latest surgeries possible. And when I saw initially about robotic surgery, I said, "Oh wow, that's so
fascinated.
good." And then seeing the effect and people performing
And the
robotic surgery, I
outcomes.
thought like, okay, I should also be doing this. And here comes the role of RG Hospital, where they actually bought the robot, and you know that because unless and until you buy such a costly robot, it's very difficult.
wouldn't- yeah,
you know,
exactly.
and it's not just it benefited me; it benefited the patients as
Patients
well,
as
whom we
well.
are operating,
Right.
and they are getting the best possible outcome out of it. So. Yeah, I mean, it's a fascinating world in robotic surgery where you can see anything not under the sky but under the abdomen,
Under the abdomen.
and see
Right.
it very nicely and in a very, very precise manner
Precise
and
manner.
very clear manner, and
Absolutely.
give the best desired result to the patient.
Right. So, doctor, what would be your message to all our viewers who's watching this interview? What would be your message about robotic surgery?
I would say, robotic surgery is one of the best surgeries at the moment available, probably apart from the laparoscopic surgery. Being a general surgeon and a laparoscopic surgeon, I would say laparoscopic surgery offers so many more advantages over general surgeries in open surgeries. And now that the robotic surgery is en vogue and you know is being used for all types of surgeries, the robotic surgery is definitely far more superior and much more easier to perform and more patient friendly, so that the patient recovers well in time with very less chance of any complications, less chance of bleeding, less chance of pain, and once that happens, the patient can go home very fast and return home very fast. So any person who comes with a problem within the abdomen should definitely consider robotic surgery also as an option, because it is much better, if not as good as a laparoscopic surgery.
Right. Dr. Vardhan, thank you so much for coming to the studio
My
and
pleasure.
enlightening us about and sharing your insights on robotic surgery. I'm sure all our viewers are enlightened about robotic surgeries in Goa, and I hope they always choose the option of robotic surgery over laparoscopic and open surgery. Thank you so much for watching this interview. Keep watching Prudent. Thank you.